Welcome, you're watching Eye on Africa. Thank you for watching us. First, the headlines. As leaders gathered for the One Health Summit in France on this World Health Day, we'll talk about a silent killer that is becoming a more significant threat to Africa than HIV and malaria, the antimicrobial resistance. A woman seeking care was beaten by her doctor in Kinshasa. The video went viral and sparked outrage in DRC, exposing a crisis in delivery rooms and violence against women. As Rwanda marks the 32nd anniversary of the genocide against the Tutsi, its young generation is forging a future, despite a painful legacy that still weighs heavily on their lives. For many, carefree moments remain a struggle to reclaim. On this World Health Day, world leaders, including from Ghana and Botswana, gathered in France for the One Health Summit, an opportunity to discuss a silent killer that is becoming a more significant threat to Africa than HIV and malaria. The antimicrobial resistance. Antibiotics have long been one of modern medicine's greatest weapons, but in Africa, that weapon is rapidly losing its power. New research suggests antimicrobial resistance is far more widespread than previously estimated. The Africa CDC warns that drug-resistant infections are now killing more people on the continent than HIV, tuberculosis and malaria combined. Gilbert Osena, thank you for helping us. You're a researcher. Thank you for helping us unpack what could contribute to this major crisis. So first, explain in plain language what antimicrobial resistance is and what it means for a patient.
Thank you, Clarice, for having me. It's a pleasure. Now, antimicrobial resistance is when the pathogens, the things that cause diseases in our bodies, they develop ways to evade treatment that were previously successful. So if last year you could treat this infection using this drug, today you cannot, because it has found a way to withstand the effects of that. And for the patients, it depends with the patient. If you're a patient and you're already you've come to the hospital, you're already sick, then there are chances that you might spend a lot more time in the hospital that you previously anticipated. And if you are just a mother wanting to bring in a new child into this world, maybe the cesarean option might be off the table, because you need antibiotics after most of these surgeries to keep infections away. So it is something to think about.
So, Gilbert, what is the main driver of this issue? Is it the overuse of antibiotics, for example?
Yeah, so that is part of the problem. The overuse and also just the transmission of this already resistant pathogens. But with the point that you bring about the overuse, I mean, in Africa we have, you say it is ease of access, but it is not good access to antibiotics, because it is an access that leads to misuse. We don't have access to the right and effective antibiotic, because most of the time these antibiotics, you can easily access them in the markets without any prescription. And you don't want that. The antibiotics are your most important arsenal, and you want to get the right ones from your healthcare practitioners, which unfortunately our societies don't really follow that. So it's ease of access that you can find them all over, but it's not the right access. You don't have access to the right antibiotics.
The right antibiotic, but there's also the problem of fake antibiotics, isn't it?
Yes, and the problem also is that now the latest report was that around 30% of the antibiotics in our region is falsified. And now, what happens when you have such substandard products, and then you take them, the patients take them, it means the dose you are taking is suboptimal. And when you take suboptimal, it means it is not enough to kill or to treat you from the infection that you have. So what you end up doing is that you prime the bacteria, and so now they learn more ways of how to evade that antibiotic, even if now you get the right one. So, yeah.
So what do you think, what is the most urgent actions that, for example, the government could do to prevent that silent killer?
Right. The government has a role when it comes to putting in the regulations. If you can regulate access of these antibiotics so that you only the right people who need them get them. But also on a wider scale, the society has to change its approach to how we treat antibiotics. But with AMR in particular, I think the government, by implementing the wash principles, the sanitation and hygiene, improving those ones, and also having strong awareness campaigns on the consequences of misusing these antibiotics. Those should be the key areas that the government needs to address. It's not like they're not doing it, but I think when you have good political goodwill with the concerted efforts that you see are intentional in cracking down on the misuse, and also cracking down on the poor sanitation by improving such conditions. I think you limit the transmission, and then you improve the use. Then I think with those two, you stand a better chance.
Yes, goodwill of the politicians. Thank you very much, Gilbert Gosena. Thank you for your analysis and help us understand that about that silent killer. Thank you very much. Now, Russia says 16 Cameroonian soldiers have died fighting in Ukraine. Cameroon's government admits they were part of Russia's war, calling it a special military operation. Authorities are now contacting their families. This comes despite Cameroon's earlier efforts to stop its soldiers from defecting. Ukraine claims over 1,700 Africans have been recruited to fight for Russia, many tricked with fake jobs or training offers. Similar cases have been reported in Kenya and Nigeria, and investigations show African women have also been targeted to support Russia's war. Now to a video that went viral and sparked nationwide outrage. It shows a doctor in the DR Congo hitting a female patient in a hospital in Kinshasa. The woman had just given birth. According to feminist groups, violence against women in delivery rooms is a recurring problem, symptomatic of a wider crisis in public hospitals. Aurélie Bazara-Kibongula reports from Kinshasa.
Purcell gave birth in a public hospital in Kinshasa 2 years ago. It was a traumatic experience. With tears in her eyes, she recounts her ordeal.
I couldn't push, I was in terrible pain. The midwives insulted me, called me stupid, and said they were going to let me die. They hit my legs and thighs very hard to force me to push.
After 48 hours of suffering, a doctor decided to perform an emergency caesarean section. She says the act saved her life, but it left her deeply traumatized.
When I see the scar on my stomach or look at my child, I still feel the pain of giving birth. I thought I was going to die.
In the Democratic Republic of Congo, violence in delivery rooms is a topic that remains taboo. But a video which was recently shared widely on social media has sparked a debate about the issue. The video shows a doctor striking a young woman who's just given birth and who refused to be stitched up without anaesthetic. The shocking footage sparked nationwide outrage. A court in Congo's capital, Kinshasa, recently sentenced the doctor to a 2-month suspended prison sentence, finding him guilty of causing minor bodily harm. But feminist groups say the sentence is too lenient. They're calling into question the country's whole healthcare system too, where hospitals are often short of drugs and gynecologists poorly trained. They say urgent action is needed.
Impunity means that this gynecological and obstetric violence is hidden under the guise of saving a life and saving lives. However, even if a life must be saved, this must be done with respect for the person's dignity.
This activist says she's seen at least one woman a week who's been traumatized by her experience of childbirth. But there are no official figures. In Congo, violence towards women in delivery rooms is a phenomenon that's poorly documented and rarely punished.
On April 7, 1994, years of genocidal ideology, hate speech, and systemic discrimination erupted into the genocide against the Tutsi, claiming over 1 million lives in just 100 days. 32 years later, for the young generation, the genocide is an ever-present legacy that has often robbed them of their right to lightheartedness. Long confined to the role of survivors or heirs to the trauma, these young adults are now using art, tourism, and entrepreneurship to unlock the national narrative. Our correspondent Aurore Bayoud met those who refused to be defined slowly by the past.
Smiles, momentum, and raw energy. Beyond the scars, Jacques Kizingabo captures a Rwanda turning towards the light. He belongs to a generation in their 30s who is tired of seeing their country defined only by the genocide.
The genocide against the Tutsi in 1994 has affected everyone, and myself too. I lost my own father when I was 10 days. I think there is so much people are misunderstood about my country. And through what we do as artists or creators is to educate and also inform. That's our role.
At 2,000 meters, Mireille Egiozo prepares to lead the family estate, Juru Coffee, the sky in Kinyarwanda. A promise of elevation for these hills once shadowed by suffering. For her, exporting Rwandan coffee is much more than just a business. It is a tool of soft power designed to overcome the country's historical stigma.
The people I've met, they tend to say, where are you from? And when you say Rwanda, they respond Hotel Rwanda. But there's more to Rwanda than that. As you can see, there's coffee, there's mountains, there's agriculture in general. There's plenty to do, there's business opportunities.
It is also from the heights that Joshua reveals a different side of Rwanda to his visitors from India, China, and Ethiopia. But his hikes carry a message for future generations too.
Most of the time, we just cross in the villages. We meet a lot of different people. So because just people, even especially kids, they like to see people moving around. So I like to motivate them. Even most of the time, I tell them, you go and start there, just become a tour guide like me.
A generation reshaping the identity of a nation as the direct witnesses of the genocide become fewer with each passing year.
Now we leave you with these images coming from Lagos with the Fanti Carnival. The event, celebrated for generations, has been a living bridge between Brazil and Africa. And as you can see, beautiful costumes to honor the legacy of Afro-Brazilian returnees who settled in Lagos centuries ago. The Fanti Carnival takes place in April during the Easter holidays to coincide with the Catholic feast day traditions that the Aguda communities brought back from Brazil. The Lagos Fanti Carnival ending this edition of Eye on Africa. Thank you for watching. More news to come on France 24.